Hello, I'm Dr. Keith Hodge of Monarch Plastic Surgery. Welcome to the Aesthetic Angle. Today's topic is fat grafting, one of my favorite topics. I love fat. I love to remove fat where people do not want it. I love to place fat where people need it to help rejuvenate certain facial features. Today, I'd like to run through a few examples of some of my patients that I've done where they've had a facelift and some fat grafting. And I think you'll see that fat grafting really is the icing on the cake when we're doing facial rejuvenation. As we age, we all lose volume. You can't get away from it. Typically, it's in the temple region, the cheek region, your nasolabial folds, and this little area we call the marionette line. And most people can benefit from fat in those areas or fillers. Of course, the gold standard is fat. So long as you have fat, there's nothing like it. A facelift can do a lot of things. It can take care of a jowl, it can give you a very sharp jawline. It can rejuvenate your neck, give you a nice angle below your chin, give you a soft, smooth skin of the neck. It can help rejuvenate that cheek volume. But there's still going to be volume loss with that fat grafting. So most of my patients would benefit from fat grafting when I'm doing a face and or neck lift. I usually harvest the fat from the abdomen, and we collect it sterilely in a canister, wash it so it's pure fat, and then re-inject it through a tiny little needle access point in certain areas to slowly infiltrate the fat in very small doses so we get a capillary ingrowth of the fat so it takes. Of course, the other option is fillers. Let's talk about fillers. Fillers are great because they're off the shelf. You know, if you get a 1 cc syringe, you're going to get 1 cc of volume. The filler can be dissolved if you don't like it. And of course, you can use multiple syringes if you need to. But that can get expensive. And you have the recurring cost of additional filler once that slowly dissolves over 6 to 9 months or a year. The other advantage of fillers is there's no donor site. You don't have a procedure to obtain the filler. It just comes off the shelf. The advantage of fat is that, again, it's going to take. You're not going to have a reaction to it. The disadvantage of fat is that you have to have liposuction to collect the fat. So there's going to be some healing from that. And the other disadvantage of fat is that I tend to overfill it because you never get 100% take. So we tend to overfill. And if I'm doing a facelift type procedure, if you add the fat, there is some additional soft tissue trauma. And so your swelling is prolonged by a couple of weeks compared to not having fat grafting with your facelifting procedure. But in my hands, there's nothing better than fat to enhance the rejuvenation process of whatever procedure we're doing. So this first patient had a deep plane facelift and a neck lift. She was dissatisfied with the appearance of her neck primarily. What I noticed about her face was that her eyes also showed some signs of aging. So I said, let's take the fat from your neck and move it to your cheeks and your lower eyelids. So she had no additional donor site. And that's not always the case, but in this case, it was great because she had no additional donor site. I harvested the fat from her neck. I didn't need much. We collected it sterilely, washed it, and then re-injected it through a tiny needle access point in her cheek. And we really rejuvenated the appearance of her lower eyelids and gave her additional cheek volume that she needed. And so it just really enhanced her result. And this is her result at 2 months. You see a very smooth transition from her lower eyelid to her cheek. You see additional cheek volume, a very sharp jawline, and a much better angle of the chin and neck region. This next patient had a deep plane facelift with facial fat grafting. She did not have a real problem with her neck. So we just focused on her cheeks. So first procedure is the deep plane facelift. That's going to rejuvenate the neck, give her a better angle, a better contour. It's going to give her a very sharp jawline. And that is followed up with the facial fat grafting. In her case, we added fat to the temple region, the cheeks and the lower eyelids, the nasolabial fold, and the little crease here we call the marionette line. And so you can see here we have a much smoother lid cheek junction, much more cheek volume, a rejuvenated appearance of her cheek, and the fat has stem cells in it. So I feel like it really enhances the appearance of the skin in the face as well. And this is her result at 2 months. The third example is a gentleman who had significant weight loss. And so he had significant jowling with that and loose skin of his neck. So he had a deep plane facelift combined with a deep neck lift. We call it a platysmoplasty, where we remove fat from under the chin and tighten the muscles of the neck, and then rejuvenate the cheek area and jawline with the deep plane technique. Then we did fat grafting. I placed 50 cc's of fat in this gentleman's face. It's in the temple region and his cheeks primarily, and to a lesser degree, the nasolabial fold and the prejowl sulcus. This is his results at 3 months, and you can see he's a younger version of himself. He needed this volume. He looks like an energetic, healthy man ready to do anything and take on the world. So fat is very powerful. Our next example shows a lady that a lot of people look at her and go, you look great. You don't need anything. But she wasn't satisfied the way she looks. And that's really what's important. You want to look like you feel inside. I mean, this lady is a, active, healthy, vigorous woman, and she felt like she wasn't looking that way anymore. So she came to me for facial rejuvenation. So she also had the deep plane facelift and neck lift with fat grafting to her upper eyelids, her lower eyelids, her cheeks, her nasolabial folds, and her marionette area, and also had an upper eyelid blepharoplasty. So once again, after we do the deep neck and the deep face, we harvest the fat, we collect it, wash it, re-inject it through needlepoint access points. She had volume added to her temple region, her upper eyelids, because there was a little hollowing, her lower eyelids, and the cheek. And you can see a much smoother transition in the lower eyelid to cheek junction. You can see fullness of the upper eyelid, which is much more youthful in appearance. And she also has a beautiful neck and beautiful cheek contour, very smooth with no jowling. So once again, if she had not had the fat, her result would not be as good. And this just looks a younger version of herself. She's happy, she looks rested, she looks youthful, she looks reinvigorated, and now she can go about her active lifestyle. So these are 4 examples that I think demonstrate the power of fat grafting. So if you're considering facial rejuvenation, I think you should always consider fat grafting. That's it for today, Monarch fans. We'll see you next time on The Aesthetic Angle.